ratio of omega-6 fats to omega-3 fats is 3-to-1. Because omega-6 fats are less flexible, but they also are less reactive, and they're good for storage. So you still find quite a bit of them, even in healthy foods, because they help to prolong the shelf life of healthy food. In our country, with the amount of animal fats and the amount of fried food we're getting, our omega-6 to omega-3 ratio is more like 20-to-1. So the drug company's answer to that is to suggest that you take some omega-3 fats, right? Because then you'll have all these omega-6 fats in your diet, you'll add some omega-3 fat supplements, and then you'll be at a 3-to-1 ratio. But then, of course, you'll be swimming around in an oil slick, and your immune system hates that. We found that when you remove the animal fats from the diet and remove the fried food, you see reductions in pain in these patients with arthritis virtually immediately, within 2 weeks of starting the diet. And over the entire randomized controlled trial, we saw increases in functionality and decreases in pain. So it works like crazy to get animal fats out of your diet to reduce inflammation and pain. Works like crazy. But the protein is a problem too, because the proteins, the animal proteins, when they're in your intestines, cause some inflammation directly to the lining of your intestines and result in these lining cells sort of separating in what we call leaky gut syndrome. So that some of the bacteria, some of the pieces of protein that are not yet digested, that should really never leave the inside of your intestine, end up going across the intestinal wall and into your bloodstream. Your body hates this. It hates having these little particles in your blood that don't belong there. So it immediately sort of wraps it up, like with bubble wrap, to protect you from it. And the body's bubble wrap in this case is immunoglobulins. So it creates an immune system response to this bacteria. These bacteria, these small bits of protein, have been tied to diabetes and hypothyroidism and rheumatoid arthritis. And in a lot of cases, what we do with inflammatory arthritis is take medication so that you decrease your immune system's response to the inflammation. And what we really should be telling people is just go vegan. And then you won't have this crazy bacterial translocation, this leaky gut syndrome. You won't have to take these weird immune modulating medications. And then the great thing is the side effect of going vegan, right, is decreasing heart disease, decreasing cancer, saving some animals, fabulous bright eyes and clear skin, instead of the side effects of rheumatologic medications, which are, tuberculosis and higher rates of certain cancers. The side effects of a vegan diet are pretty nice. So it's a great way to control arthritis pain in all types of arthritis. There's 14 clinical trials showing benefit with rheumatoid arthritis with dietary modification. So we know that your chances of heart disease decrease dramatically going from a meat eater to a vegetarian and then to a vegan, presumably by reducing inflammation and reducing negative fats. There's also benefit to decreasing your risk for cancer, and that's coming primarily from this insulin-like growth factor, or this is at least one mechanism that's a really terrific mechanism. Insulin-like growth factor stimulates the growth of rapidly dividing cells. And IGF is present in its full-on form in dairy, in dairy products. So it's important to get rid of the dairy, because if you're a little tiny baby and you need to grow, right, every cell in your body is growing, load that baby up with IGF and get them to grow really big. But if you're 43, the only thing growing on me is fat cells or any cancer cells that may have inappropriately divided and are trying to get a foothold in my system. So getting that IGF out of my system is really important.